appreciate everybody taking time out of their night. I know it's during the week that's the hardest time to kind of do these things, but we really appreciate the gesture. So my name is Elizabeth Alba, and this is...
I'm Nguyen.
I'm Jennifer Alvarado.
And I'm Sarah Naguib.
Okay, so tonight we wanted to actually go through what diabetes is. And there's different types of diabetes, but we wanted to go over type 2 diabetes. So before we actually start with everything, does anybody want to tell me what they have an idea of what diabetes is? Any volunteers, any takers? Don't be shy. What do you think, what do you know about diabetes?
It's just an illness and it runs through families.
It's an illness and it runs through families. That's really good. Okay, does anybody know any other information about it before we continue? I just kind of want to know what y'all know so that way we can guide you better. And that way you can actually leave out of here knowing, I know what type 2 diabetes is. I know how to prevent it. I know what I can do for it. So that's my goal tonight, and I hope to make that happen.
There are different types of diabetes.
Different types of diabetes. Very good. Okay. So we'll go ahead and continue on. But before we do that, we have some beautiful brochures that Sarah made, and then we also have some handouts with menu choices and items that you could do as a better diet.
We also are going to administer some surveys to see what you guys know about diabetes.
There you go. Thank you. Oh, okay. I'll get you another one. There you go. I have a plan. There you go. So we'll go over the brochure first.
Alright, so if you open up the brochure, it asks what is diabetes. So we're focusing tonight on type 2 diabetes, but there's also type 1 diabetes, which prominently hits the younger crowd, and that's basically they're born with a deficiency of no insulin. They just have none, it's not working, and that means they have nothing to process the glucose in their blood. And type 2 diabetes is a lack of insulin. So you've had insulin, but as you get older or your eating habits are kind of poor and like take in too much glucose, your body is not able to process all that glucose, and the insulin is just not enough that's there. So the normal range, so if you're checking your glucose before you take your medications, or you're in the doctor's office and they want to check your glucose, the normal range is 70 to 120 milligrams per milligram. So that should be the range that your glucose should be in. And of course, after you eat, it's going to be a little higher because you're processing glucose, processing sugars. And the signs and symptoms for type 1, just so you know, because I know there's a young child here, so weight loss, excessive thirst, excessive hunger is really common with type 1. And without insulin, they can go into diabetic ketoacidosis, which is just an overload of glucose. And they end up excreting that in the urine, and it's a medical emergency. And then you have type 2 diabetes, which is increased thirst, increased hunger, dry mouth, frequent urination, and blurred vision, headaches, and fatigue. So if you're experiencing that after eating sugar, you just get a bad headache, or you're tired when you don't get your sugar, that could be signals. That could be signals for diabetes. And we all know that diabetes actually affects minorities more than Caucasians in the majority. So my family, which is the Arab side, my dad has diabetes, and I know from studying in school, a lot of Hispanic cultures end up with diabetes. So it's really important to pay attention to those symptoms and to not ignore them because they can get worse. What can happen if your diabetes is not managed? You're at risk for stroke, heart disease, heart attacks, eye deficiencies, kidney, nerve disease, and reduced risk of infection. You end up getting infections because of the diabetes. Because the glucose, what happens is it's circulating in your blood. And your blood goes everywhere, your brain, your feet, your body needs blood. So that means glucose is getting everywhere as well. So diabetes is diagnosed. You usually go into your doctor's office for a normal checkup, and if you have concerns, you can of course tell them, and I'm sure your doctor will bring that up with you too, because it's very common in the US to have diabetes because of how easy it is just to access McDonald's, Whataburger, Chick-fil-A, people grab the milkshakes and the fries and everything with it, and most people don't realize that fries or potatoes or rice is actually carbs and it has sugar in it. So most people assume, oh, diabetes, that means you're eating so much candy. No, that's not really the case. You'd be surprised. I actually read an article today that the average American is consuming 100 grams of sugar a day when it should be half of that. So the most popular test that a doctor does is the A1C test, and that's the test where you don't have to be fasting for it. So in case you come in, you didn't fast the night before, they take your blood, and since your blood's lifespan is about 120 days, your blood circulates new cells 120 days, you'll find that they can read your glucose up to 3 months ago. So that's the best test they can do to see. You might have, if they do take your blood sugar, that's fine too, but it could be elevated because you ate something. So that's the most accurate way. The treatment for diabetes is to always check your blood glucose before meals. Before meals, a few hours before meals, before and after exercise, because if you exercise, you should be aware that you're consuming your carbs. So you don't want to end up with hypoglycemia, which is like low glucose, low energy, and your body will start using other means to get energy. You can take oral medications. This is, of course, if you've been diagnosed with diabetes. You can take oral medications, which metformin is the #1 diabetes medication. Most diabetics are on it. It helps you also lose weight. So that's why most of them are on it. And then if it's not managed by that way, you take insulin, which is just basically a replacement of the hormone in your body. And the abdomen is usually the best site of placement for insulin because it circulates much better that way. Your doctor, there's 4 different types, so your doctor will be letting you know what you should be taking. Preventative measures, now this is for you guys because, of course, I don't think anyone's been diagnosed with diabetes yet, and even if you have, these are ways to help get rid of it. So manage your diet. It should include fruits and vegetables, which is 5 to 9 servings a day. Fish, lean meats, dry beans, whole grains, low-fat milk, and cheese. These all have less glucose in them. Need to eat less salts and fats. That'll help as well. Try to maintain a healthy weight because we all know once people lose weight, that's the best way to get rid of many things, like risk factors for other things like high cholesterol, diabetes, stroke, heart failure. All obesity, guys, is like the biggest thing, unfortunately, which is really hard to take care of. You should try to get at least 30 minutes of exercise 5 days a week. Take a stroll out. The weather's nice out now. We can finally go outside without getting bit by mosquitoes or sweating so much. Be sure that if you do have diabetes, you do not mess with your feet. They tell you that as diabetes progresses, your nerves become damaged in your feet. I had a patient recently who actually tried to perform a procedure on his foot. He ended up with an infection and he couldn't walk anymore until it healed. So it's because you can't feel it. If you're sitting there messing with your feet and you can't feel it, you don't know when you're damaging yourself or not. And because you can't see very well the bottom of your foot. Also, stop smoking and decrease alcohol intake.
Okay, so what we're gonna go through over is this paper here. It looks like a graph, has all the bars on it. So just to kind of recap on what Sarah said, with glucose is just the sugar in your blood. So that's just glucose is just a fancy word for sugar in your blood. And then what she was talking about, insulin. So our pancreas in our body is what secretes insulin. It's what makes the insulin. So our pancreas in a normal body is working really well. It's secreting that insulin and it's eating all that sugar up for us so that we don't get diabetes. Now, with type 1, your pancreas is not doing its job. It's not giving you insulin. It's not doing anything like that. So that's why they have to take insulin. That's why they have to get administered shots. Now with type 2, your body actually produces it, but it's just not producing enough. And you're consuming so much sugar as it is that it's just not enough. Something has to give. So then that leaves with the high blood sugar. So just to kind of recap on that. And then she did talk about the diet. So with the first one, it goes from top to bottom. on the side it says percent increase in diabetes risk. So processed meat, it's like when you go to the grocery store, all the deli meats that you see that are processed, prepackaged, that's processed meats like ham, bologna, the little ham that you see with the cheese in it, that's prepackaged, processed. And then soda, I know soda's a big factor for me. I have to have, if it's not Red Bull, it has to be solid Coke. Like I need caffeine. I'm in nursing school. I need to stay awake for hours and hours and hours. And then unprocessed red meat. It's not as bad because it is unprocessed, but red meat, we already know it's a big thing. It leads to like stroke, heart disease, cancer. There's not cancer, but heart disease and stroke. Different things that are actually giving more and more bear on our body. And then white rice. So like Sarah said, white rice is a type of carb, and there's good carbs and there's bad carbs. With anything that's like, have you ever seen, like in the grocery store, you'll see bleached flour or brown sugar, or you'll see enriched flour. Basically all it's saying like that, whenever it's saying enriched, they've depleted it so much from its natural state that they have to add vitamins back. That's all enriched means. So whenever you're getting that depleted state, it doesn't have the regular nutrients that, let's say, whole wheat bread would have. So whenever you go into the grocery store, and I know growing up on white bread, it's so good. It's the best with peanut butter and jelly sandwiches. But then once you go to whole wheat bread, it's not the same taste. So I know there's a give and take as far as the taste, but what's really gonna be important to you whenever you're getting older and you're trying to change up your diet. So white rice, we would want to switch to brown rice. But as long as you're not eating too much white rice, you should be okay. So then to decrease your risk, so leafy greens, spinach, kale, all the good stuff, that has all the best vitamins in it. So the more natural it is, the better vitamins that you're getting into your body. And then apples or pears, so fruits. We want good fruits in our body. So like Sarah said, 5 to 9 servings a week. And then your whole grains, that's what we mentioned earlier. So if you're doing like steel cut oats, whole grain, whole wheat, there's a big difference between multi-grain and whole grain. You want to go for the whole grain. Multi-grain is just a bunch of it in there. A lot of people think, oh, multi-grain's good, I'm doing awesome, I eat multi-grain every day. It's actually not good. It's actually in the same category with white bread. So you want to stick with whole grain. And then nuts. So almonds, cashews, peanuts. Of course, not the candied sugar kinds that we get at the mall. Not those. The ones in their natural state. Just without any flavorings, without any salt. I know it's not as good, but. And then we have our low-fat dairy. So anything you see like 1% milk, even skim milk, even 2%, that's doing better for us than it would for whole milk. And then coffee. Now we mean black coffee, not coffee with lots of sugar or lots of Splenda and lots of cream. I know that's the best kind. Starbucks has the best one too. But we want to stick with black coffee. Black coffee is going to be the best one for that. So far, I know we're giving you a lot of information. We're throwing a lot of information at you. Does anybody have any questions before we continue to the next part? No? Yeah.
Check the camera really quick, make sure everything looks
And
right.
what you said about apples and pears and stuff, you also gotta take that in moderation though.
Yeah, that's what we say.
The amount of servings that you get, because you get a lot of sugars from it also.
But it's a lot of natural sugar. It's not the same sugar that's gonna, like I said, whenever you see like in stores that it's been out so much out of its natural state. Like if you see sugar on the raw, it's much different than sugar that's been finely milled and bleached. So sugar on the raw is actually a much thicker and larger grain, and it's brown. It's not white.
And it's actually better for you?
It's actually better for you. Sugar in the raw is actually better for you. So that, like I said, anything in its natural state is going to be the best before it's been processed and added and milled through. So that's. I know it tastes the best. I've had sugar in the raw with my coffee, and I have to add like 10 packs before it tastes good to me. But that's not, of course, everything in moderation.
Is it good?
Yeah. Good. Okay. The survey. Okay, so Jennifer's gonna talk about the next sheet that she gave you about the survey.
Okay, how are y'all doing tonight, y'all? Great, good? Okay, good. So this survey is made to assess what you want or need to learn by the end of this learning session. So I'm gonna start out by asking questions. You can either choose to answer or you don't choose one answer, that's fine. How do you feel about diabetes mellitus? Are you willing to learn, interested, indifferent? I don't really care for it.
Oh yeah, we all need to know about that.
Yes, it is something, it is actually we all need to learn about, because It's actually really prevalent, especially in the Hispanic community. Do you frequently have headaches?
Yes.
Yes. So that is a symptom of diabetes mellitus. So it also depends on how frequent you have them. So if you have them more than 3 times a week, you should see a doctor. But it depends. There are some severe symptoms that we're going to get to. Does anyone in here believe in herbal medicine or family traditions to relieve pain or illnesses? A lot of Hispanic community believes in herbal remedies. Do you believe in some sort?
Yeah,
What do you believe in? If you don't mind me asking.
well, like spearmint, the trees that you grow, the little grass, you boil that, it's good for colic,
Oh
good for
yeah,
upset stomach.
definitely.
The Arab culture brings me to all the time,
Yes.
smells everything.
Yeah.
We have it at home all the time.
I know in my Hispanic culture we believe in some newspaper that you put in when you have an earache, you put it to your ear. You put it to your ear to relieve ear pain. Yes.
Yes.
Okay. The next question is, are you frequently thirsty? Because with diabetes, you have, does somebody want to explain the pathway for me with diabetes? That
So-
you get frequently thirsty?
With the background why you're always thirsty, you have so much sugar in your blood. I mean, that sugar is just circulating everywhere. It's going everywhere. So with a lot of sugar and a lot of water, what does sugar do to water? It absorbs it. It takes it away. So that's why you're like, oh, I'm really thirsty. I have headaches all the time. That's behind it. That's why you're so thirsty.
Oh, okay.
I have that problem, same thing.
It's okay. With being frequently thirsty, do you often experience a dry or cotton mouth? That's also another symptom of diabetes mellitus.
Oh man, I must have that.
Do you ever experience extreme tiredness? More than twice a week sometimes? Yes, that's a symptom, but it can vary because you have to have all of these symptoms in one, like, yes. Okay. Do you visit your health care provider or doctor frequently? Yes. Okay, good stuff. Okay, well, then that's
She said no.
Insurance pay.
Oh,
Once a year.
yes, that's another factor, the insurance. Do you experience having appetite even after eating meals?
Experience that?
Experience after eating meals? Yes.
What's some snacks?
Yes. That is also a diabetes mellitus symptom. Do you have blurred vision?
Well, I need my glasses a lot.
Yeah, I work.
Yeah, or glasses. Yes, glasses.
It's getting worse.
Okay. Do you experience frequent urination? This is a private question. You don't have to answer it, but a diabetes patient would experience frequent urination, thirsty, cotton mouth, and blurred vision.
Your body's trying to get rid of that glucose any way possible, so
Yes.
you just keep excreting, and then you just end up low. That's why you're thirsty too, because your body's trying to excrete it as well.
Okay. And that concludes my survey. We're going to go ahead and get started with the presentation now with T.
This is our type 2 diabetes presentation. I'm going to start with the patho, a quick overview. It's a genetic environmental interaction. Appears to be responsible for type 2 diabetes. The risk factors are your age, if you're obese, if you have hypertension, if you don't have regular exercise, and family history. It runs in the family. Next.
Definitely runs in the family.
This is just an overview of how you see it works. Next. And this is type 2 diabetes. It shows you how your cells are insulin resistant. I have a quick video for you guys.
We've talked about what diabetes can be scary, but don't panic. People with diabetes can live long, healthy lives. Sure, let's go over some basics. This is diabetes. Made simple. When we eat, food travels to the stomach. Food is made up of 3 basic nutrients: carbohydrates, proteins, and fats. During digestion, carbohydrates are broken down into sugar, otherwise known as glucose. Here's a quick fact. Carbohydrates include foods such as bread, rice, pasta, potatoes, fruit, milk, and yogurt. In a normal digestive process, sugar travels from the stomach, through the bloodstream, to your body's muscle and fat cells. However, sugar can't enter these cells without the help of a special hormone called insulin, which is produced by the pancreas. Insulin acts like a key, unlocking the doors to the muscle and fat cells and allowing the sugar to enter. The cells then use this sugar as fuel to provide energy for the body. When this process is functioning properly, sugar entering the bloodstream from the stomach is able to exit the bloodstream at the muscle and fat cells. In this manner, the body is able to regulate the concentration of sugar in the bloodstream. Now let's see what happens in a person with diabetes. Sugar enters the bloodstream, but one of two things happens. Either the pancreas does not produce a sufficient quantity of insulin to match the sugar entering the bloodstream, or the body cells do not respond to the insulin that the body is producing. In both cases, the result is the same. Cell doors remain closed, causing sugar to get backed up in the bloodstream. As a result, blood sugar levels rise. This creates several problems. Because sugars are not able to enter your body's cells, your body is not getting the fuel it needs. As a result, you may feel tired or fatigued. Your body may try to dilute the excess sugar in the bloodstream by pulling fluid out of your cells. This can leave you feeling dehydrated and thirsty. Most importantly, over time, exposure to high blood sugar levels can cause damage to vital organs connected to the bloodstream, such as your eyes, kidneys, nerves, and heart. If not controlled properly, diabetes can lead to serious complications, such as blindness, amputation, kidney failure, heart attack, and stroke. In order to avoid these complications, people with diabetes must take steps to keep their blood sugar levels in a normal range. One way to do this is through diet. By reducing the amount of carbohydrates you eat in a single meal or snack, you can regulate the amount of sugar entering the bloodstream and prevent your body's insulin supply from becoming overwhelmed. This may mean limiting high-sugar foods such as cake, pie, candy, and soda. You know which ones. Another way to regulate blood sugar is through exercise. Physical activity makes your body's muscle and fat cells more receptive to insulin. In other words, those muscle and fat cells that wouldn't open before, now they will. Finally, your doctor may prescribe oral medications to increase your supply of insulin, regulate the amount of sugar entering the bloodstream, or make your body's cells more receptive to the insulin your body is producing. In some cases, insulin shots may also be necessary. Okay, let's review. We've talked about what diabetes is, a condition where either the body does not produce enough insulin, or the body's cells are not receptive to the insulin being produced. We've seen what complications can arise from it, such as fatigue, dehydration, and damage to vital organs. Finally, we've discussed ways to manage it through diet, exercise, and medication. For more information about your specific health diagnosis and treatment plan, please talk to your doctor. Finding out you have diabetes can be
Defining signs of type 2 diabetes, uncontrolled or pre-diagnosis. High blood glucose means you have hyperglycemia. To diagnose, the 3 glucose meter readings above 126. Out of range hemoglobin, your A1C test is above a 6.5. Fasting plasma glucose, test above 140. And random plasma glucose, test above 200. This is a graph of your A1C, fasting plasma glucose, and blood glucose levels. This is your normal range, your pre-diabetes and diabetes. Symptoms of type 2 diabetes, Sarah went over it earlier, but I'm going to go over it again. Initial symptoms are non-specific. You may show polyuria, polydipsia, extreme thirst, and extreme urination. More often presents with broader symptoms such as fatigue, you're tired, pruritus, itching of the skin, recurrent infections, visual changes, and symptoms of neuropathy such as paresthesias or weakness. This is the symptoms. That's a graph so you guys can see it. Feel drowsy, increased thirst, increased hunger. Yeah, blurry vision. Here's a complication, the signs and symptoms. For hypoglycemia, you have low sugar, aka insulin shock or insulin reaction. You have low blood glucose level of 55 to 60, your symptoms. General mental status, you have restlessness, anxiety, hungry, fatigue, you're irritable and you can't focus. For skin conditions, you will be sweating and you will be pale. Cardiovascular, related to the heart, you have tachycardia, high heartbeat, high heart rate. Palpitations, for neuro, it's tremors, dizziness, visual disturbances. And worst case scenario, you have convulsions, leading to coma, leading to death. For hyperglycemia, you have too much sugar. The signs are obviously high blood glucose levels greater than 600, high BUN, high creatinine, pH is less than 7.3. Symptoms for GI is nausea, vomiting, abdominal pain, weight loss. Your skin, parched lips, poor skin turgor, which means like if you were to do like if you were to pull up on your skin, it would stay in that position because you're super dehydrated. Cardiovascular, you have tachycardia again, hypotension, urinary, polyuria, polydipsia, frequent urination, and extreme thirst is polydipsia. Hypovolemia, which is a low volume of blood in the body, dehydration. Worst case scenario, coma seizures. And this is just some pictures for you guys to see the signs and symptoms I went over hypo and hyperglycemia.
Oh, that's how you feel.
Yeah, so there's a lot of cases where people walk around and you think they're drunk, but they're actually hypoglycemic. They'll have like a fruity breath to them. So like it's actually interesting. I've heard stories like they see people walking and they just look drunk. So people just like, I'm gonna stay away from them because they're drunk. They could be crazy. But in reality, they need some quick form of glucose, orange juice, something sugary, something. I mean, if they have medications, they would take their some type of medication, or like the Halls that everyone's carrying around. You give them some Halls because it has a lot of sugar in it. So that's another case. Like when I know they tell us when someone walks into the emergency room like that, don't assume that they're already drunk. They could be in serious need of sugar, and that's when you're in the hospital. You'd administer glucose via syringe so they can get it immediately.
Clinical chronic complications, signs and symptoms, you would have blindness, kidney disease, nerve damage, you might have to amputate, loss of circulation in arms and legs, leading to amputation, stroke, heart attack, microvascular diseases. You have diabetic retinopathy, leading cause of blindness, reports of blurred vision, you might see fluid leaking from your eyes. You will see hemorrhages on your retina with an ophthalmoscope. So when you get your eye exam, your doctor might tell you about that. Diabetic neuronephropathy, a few early symptoms. You might see protein in your urine, elevated kidney labs, nocturia. It means you urinate when you sleep. You get up and urinate a lot. Swelling in lower extremities, high blood pressure, and diabetic neuropathy. You have pain in your periphery. Foot drop or wrist drop, and sensory defects. This is a sign you have swelling in your limbs. So it would be like a pitting edema.
For all the medical terms that we're using, we're just kind of trying to educate you and use like normal wordage of what yes.
Okay, like the hyperglycemic, is that part like what she was saying too, that other one?
There's
The doctor one time called me, but then I don't know, all of a sudden it was like it went away, but they said that I had hyperglycemic. But this is a while back when I was pregnant. And then they said it went normal. But then she was saying all the symptoms that she was saying right now, I had a lot of that, well, most of them.
Well, usually that's there's different, like we said, there's different types of diabetes. So like there's type 1, type 2, diabetic ketoacidosis, and there's gestational diabetes. That's where you get diabetes whenever you're pregnant. And you'll see that a lot of women who have gestational diabetes, they have big babies. They have 9, 10 pound, 11 pound, 12 pound babies. Those are big babies. So that's why they have to do something about their diet and try to control their sugar while they're pregnant, because if not, it affects their child as well.
And we learned that after they have the baby, the diabetes goes away, but they are a lot more likely to have diabetes 10 years after giving birth. So they develop it within that 10-year span. Yeah.
But we need to remind us that way y'all can put that.
Oh,
into
we're gonna edit it, so we're good. Yeah.
No, I'm talking about all these questions.
Oh, yeah. And just know like hypo, the way I think of it is like hypo, low, and then hyper, I'm hyper, there's a lot. So hypoglycemia means low sugar. Hyper means a lot of sugar. Yes, you have to have acronyms whenever you have to learn all this information.
So is type 1 and type 2 treatable?
They're both treatable. Type 1 is going to be more of the medicated one. That's where your body's not producing any insulin, so you need to administer insulin. That's when you'll see the people who always have their AccuCheck, like that little monitor. And it's actually funny. I was going to Kroger's to pick up some stuff, and I see all the sweetbreads are next to the AccuCheck. So I'm like, really? You're going to do that to a diabetic patient? They're going over there to pick up some more monitors, and there's all the sweets. That's really mean. But that's where type 1 is where it's just you need insulin. Type 2, it's where your body's producing insulin, just not enough. So that's why you have a lot of high blood sugar. And type 2 diabetic patients can actually get so far worse to where they might need insulin. Just because if they don't do anything about their diabetes, then they might get to that point. I actually had a patient who was diagnosed with diabetes when he was 20 years old. And I was actually working with him. He's 37 now. He came in, he told me that he did have diabetes, but he left it untreated for, 17 years? He's like, I felt good, so I didn't even worry about it. And he had type 2 diabetes. Up until he came in and he said that he went to Disneyland, he hurt his foot. He ended up having a sore and didn't even know it because diabetic patients can't feel their feet. After so long, your blood circulation is not as well in your legs. So that's why you see a lot of the swelling, and that's why they can't feel anything. So if anybody's ever been to the doctor, you'll see sometimes in the sign, they'll say if you're treating a diabetic patient, or if you're seeing a diabetic patient, reminder, check their feet. Or like diabetic patients, no more pedicures. They can't put their feet in hot water because they can't feel it. So then if it's too hot, what happens if it's too hot? You'll burn yourself. So with that, he actually ended up having his big toe amputated. And then there's even far worse. You see people who...
Yeah, Ms. Jones, one of our clinical instructors told us they had a patient, back when she was still working in a hospital, they had a patient who was diabetic, but they didn't, I guess the patient didn't know that they were so far gone that they tried to put them in an ice bath to help with other issues, and her skin actually like sloughed off because she didn't feel it. She sat in there, she didn't feel the cold, she didn't feel how cold it was. So that's how bad it is. And like Liz was saying, with type 1 diabetes, you have to be on insulin for life. Unfortunately, yeah, you have to be on insulin for life. Whereas type 2 diabetes, my aunt, she lost a lot of weight. She used to have severe diabetes, and she lost a lot of weight, and her diabetes is gone now. So there's chances for us to come back from that.
Any other questions? Okay. Did I answer your question?
Yes.
Okay.
Thank you very much.
So this is the diabetic retinopathy. Like we said, the blood circulates everywhere. So a lot of diabetic patients will have issues with their eyes. If you see, I've met people with diabetes, I've worked with people with diabetes, they shouldn't be, a lady had told me, oh, I can't drive at night, I have diabetes, I can't see anything, glare is really bad, so it's just good not for me to drive at night. And so at the top you see, this is what you and I would see. We see a clear picture, and then this is what they would see, because after so long, there's so much sugar going through those vessels that it just tends to damage it. So then they start to see spots. And then this is the neuropathy, where they can't feel anything. So if they stepped on a cactus, they're not going to feel that because they don't have any sensation down there. It's hard for them.
Which also causes them to be at risk for infection, because you're gonna have, you're not gonna feel it, so you can step on something and you can get infected and not even know it.
You don't have an open wound and you don't know.
Which is also why you should assess your foot every day.
But once you get something on your foot, like a cut or something, and it gets infected, you can treat it, right?
You can treat it.
If it's not too late.
My
right?
patient had to go on IV antibiotics because he had no idea that had happened to him. So they had to have wound care where they drained the incision, or they drained the wound, and then he went on IV antibiotics. He was in the hospital for a few days to clear that infection out.
So it's treatable, but it's just with diabetic patients, it just takes them longer to know. So that cut, for me and you, a cut could, a small paper cut could probably go away in like 2 days, 3 days. For them, it might take a week or 2.
And if they don't notice, that's when it gets to the point of amputation or
Infection.
hospitalization and things like that.
Yeah, 'cause I had a cousin of mine, well, my wife's cousin, actually, she had a sore on the bottom of her foot, and it got infected, they supposedly treated it, then it came back again, and they wound up taking half of her foot off, and then they wound up taking the whole foot, and now she's all the way up to her knee.
I think
So-
like gangrene.
That's why I was asking if it is treatable, you know, it's just something you gotta pay attention to and keep
Yeah.
looking
You have
at,
to
right?
catch it as early as you can, because that's why they tell you to look every day instead of once a week, or, you know, people forget about to check these things, so that's why you catch it as early as possible.
So like we were saying, diabetes can lead to different things, and then what Sarah mentioned before, obesity leads to so many things that you just have no idea. Like for example, coronary artery disease. So coronary means about our heart, and it's in our arteries, so we have a disease of that. So it's heart disease, MI is myocardial infarction or a heart attack, and then hyperlipidemia, that just means high cholesterol. So lipids, high. Remember, hyper means high. And then stroke. So you have weakness on one side, sudden confusion, difficulty with speaking, vision problems, severe headache. And a lot of people sometimes don't even realize that they're having a stroke. I had a coworker of mine, he had no idea he was having a stroke, and I was like talking to him, he was talking to me perfectly fine, and then out of nowhere, he was talking and his face just started to droop, and he had no idea. And I was like, Mr. John, you're having a stroke. And he was like, what? And it just, he didn't realize it. So some people just don't even realize that they're having it. And then peripheral vascular disease, so claudication, so your blood clotting up, and then like he mentioned earlier, gangrene, we have ulcers, slow wound healing. So peripheral is just all of our peripherals, arms, legs. We don't realize that blood isn't going there, it's not circulating well. So that leads to a disease of it, because there's not, in our blood there's oxygen, and if our body's not getting that oxygen that it needs, then it's just making problems worse.
The blood clotting, that's part of
Blood clotting,
if
well,
it's
blood clotting is
clotting too quick.
clotting too quick. So like say for example with us, we want our blood to clot up quickly,
That's how
so it
it
closes the
closes the
cut.
wound.
But with theirs, it's claudication is slow. And so
Okay.
slow,
I got you.
There's a lot of blood.
yeah. And won't even know. So a state of low blood glucose level that stimulates epinephrine and glucagon secretion, mobilizing stored glucagon and fat and their conversion into glucose. And so this is just going into like hypoglycemia symptoms. So whenever it falls below 70, that's whenever you're hypoglycemic. And then it's a big major complication. A lot of people don't realize it. Like if you have to eat at a certain time, it's important for you to eat. And then hypoglycemia and diabetes is usually a complication related to insulin treatment. So that's whenever, sometimes with type 1 diabetic patients, they'll over medicate. So they'll put too much insulin and then you're at a super low blood sugar the entire time. So you want to make sure that you're not changing up your levels on your own. Some people will feel like, oh, well, I really want to eat this cheesecake, so I'm going to go ahead and give myself a little bit more insulin. And that's a no-no. You don't mess with that. The doctor gave you a regimen for a reason.
And you have to be really careful when you're stressed. Let's say you have a lot of stress at work, or you get an infection, like flu season during this time. They tell you to go to your doctor. You have to go to your doctor, because with illness or stress, you need more insulin. But the doctor is the one who has to tell you how much more you need to take, because you don't want to over-medicate, you don't want to under-medicate. So you don't want your diabetes to make your symptoms worse or slow your healing when you're sick or you're dealing with stress.
Also, when you're sick, you should keep taking your insulin. A lot of people, or a lot of patients think that they shouldn't take their insulin, but you actually should take your insulin because you took your treatment.
Treatment requires immediate replacement of glucose, either orally or intravenously or IV. If patient is alert, consume 15 to 20 grams of glucose or simple carbs, like a glass of orange juice. Recheck your blood glucose after 15 minutes. If hypoglycemia continues, repeat. Once blood glucose returns to normal, the patient can eat a small snack if their next planned meal or snack is going to be more than an hour or two away. Hypoglycemia, again, 15 grams of simple carbs that are commonly used is a glucose tablet. 4 ounces or half a cup of juice or regular soda, not diet. 1 tablespoon sugar, honey, or corn syrup. 8 ounces of non-fat or 1% milk. Hard candies like Halls, jelly beans, or gumdrops. Next. And the treatments, if patient is unable to swallow and they're not alert, then you can give 20 to 50 milliliters of 50% dextrose IV push. If patient is in acute care setting, if no IV access, then give 1 milligram of glucagon, IM or sub-Q.
And of course, these treatments would be more for nursing. We don't expect just a normal person to be like, oh, here, I have my insulin, let me give it to you. But it is to realize that if somebody tells you, oh, I just don't feel good, I need to sit down, I have low sugar, look for candy in your purse. Or if you have, let me get you a Coke really quick. Then get them something to where they're gonna feel better quickly. Because if not, it can go downhill really fast.
And the 50% dextrose and glucagon are of course forms of sugar. They can push via IV.
Yeah, the
So,
fastest.
yeah,
so that's like
IV is the fastest route, so that's like for emergency care.
Types of oral hypoglycemic drugs. Glucosidase inhibitor, it delays carbohydrate absorption in GI tract by inhibiting disaccharides. Biguanide decreases hepatic glucose production. An example is metformin, the most common one, or glucophage. And sulfonylurea stimulate the release of insulin from pancreatic beta cells. Example, glyperamide, amaro, and glipizide, or glucotrol. Prevention, management of medications. You have to stick with your medications that a doctor prescribes to you. Diet, of course, blood glucose monitoring, and education. If hypoglycemia is not managed, it could lead to a seizure or unconsciousness, passing out, or a coma. Nursing goals. Goals of individual with diabetes you want to achieve and maintain. Okay. This is this is an insulin chart. These are the types of insulins, their onset, peak, and duration. Just so you guys can see the difference in their onset. There's short-acting and long-acting insulins. There's diagnostic tests. This is your hemoglobin A1C, is like the 3-month test that you can see. You want it to be greater. No, you don't want it to be greater than 6.5%. Fasting plasma glucose, greater than 126 milligrams per deciliter. Random glucose test, greater than 200 milligrams per deciliter. The type of your oral medications, right?
So diet, we talked about diet. Now there's a really cool method. If you just feel like I need more guidance, I don't know what to eat, I feel like I eat the same things every day, and I feel like I'm healthy. If you feel like you need a little bit more help, Michelle Obama was like really big on my plate method, and she was really big on that, to where they wanted kids in schools to get healthier, so they created my plate. Instead of versus having the food pyramid, they felt like that was inaccurate. So why not make it in the shape into a plate? And so you have your entire plate. You would have a small section of fruits, your veggies, your grains, and your protein. Your protein should be no bigger than the palm of your hand. Usually your vegetables, if you want to start eating healthier, your vegetables should be, consider it, if I'm going to fill my entire plate, I want my vegetables to be half of my plate. So that way you're containing more and more vegetables. You're going to have dairy, make sure it's non-fat or low-fat. Your grains, now you want to be careful with like greens and starches, because I didn't know this until I went to the doctor with my son the other day. I was like, well, he eats healthy things like green beans. They're like, oh, didn't you know green beans are a starch? I was like, no, it's a vegetable. She was like, no, the dietitian told me it's a starch. It's a starch. Corn is a starch. Corn is not considered a vegetable, as much as we want it to be.
My uncle, who's a doctor, he actually told my mom over the phone one day, don't eat too many carrots. Like, you think carrots are really good for you and for your eyes, but carrots have a lot of sugar in them. Yeah, especially, you can taste that when you cook it. They turn sweet. When you steam them, they get sweet and they taste really nice, and you think you're doing good, but they're full of sugar.
So if we go back to the basics, anything in its natural, raw state, best nutrients. When we start adding steamed, cooked, fried, baked, that's whenever we're actually depleting the nutrients. So you want to make sure, I know it's really hard, I should practice what I preach. I love my baked vegetables and fries, but we really need to go back to the natural state as much as you can. So your daily food plan, like I said, I gave you that chart that you could have with you. So this is what it would go by. And you would actually, you can go to myplate.gov and it'll tell you, you'll put in your weight, you can put in your name, how much you exercise, everything like that. This one's gonna be a little bit different compared to the one that I handed out like this. It's just a little bit easier to read. But this will guide it towards what you should be eating and what your goal weight is. So for this person, it recommended they have 6 ounces of grains, 2.5 cups of vegetables, 1.5 cups of fruits, 3 cups of dairy a day, so there's different types with your cheese, your yogurt, and then protein foods, 5 ounces. Now this is in a day for them. So we should be eating, instead of having big, large meals, which I know that's usually what we do, we don't have time to eat in between. So what you should be eating is small, frequent meals. So get used to kind of having to where you shouldn't go and sit down at a meal and feel like, oh, I'm so stuffed, I'm done, I'm gonna go take a nap. We need to do small meals, so that way we shouldn't be thinking that we're gonna feel stuffed and overfull. We have like a food baby. Thanksgiving's coming up, I know a lot of food babies are coming. So we just gotta stop and rethink your drink. So go on drink. Like I said, I'm a big caffeine addict. I love whatever is gonna keep me awake so I can study more. So red, we want to think of it this way. So like we have Coca-Cola, big red, anything red, drink rarely if at all. Usually anything red has a lot of high fructose in it, so it's a lot of syrup. So regular sodas, energy or sports drinks like Gatorade, Red Bull, Monster. So fruit drinks, even like juice. Juice has so much sugar. And we don't realize it. We think, oh, juice, I'm drinking juice and my water, I'm good, I'm healthy. Juice actually has a lot of sugar. And then yellow, so you do your iced tea, your orange juice, your Sierra Mist, your Sprite. Drink occasionally. So diet soda, low calorie, low sugar drinks, 100% juice. Usually you'll see it like with cranberry juice, it'll say cocktail juice. That's the one that has all the sugar in it. So you want to go with something natural to its more raw state. And then you'll see green, drink plenty. So water, seltzer water like Don Perrier or even the Topo Chico that you can drink mineral water. Or skimmer 1% milk.
And I'm sure you guys seen all those videos about Coke, how you can clean like grease and your toilets with Coke because of how bad it is for you. Like, that just makes me want to stay away.
Yeah, I don't know if anybody's ever seen to where somebody tells you, oh, just clean the bladder, just pour some Coke on it. That was just, it blew my mind when I saw my dad did that. He's like, look, let me clean your battery for you. And it was just like bubbling, and I'm like, that's what I'd like to drink every day, really. Okay, but just a quick. Okay, so calculating how much sugar is in a container. So you want to look at your nutrition facts. I know a lot of us, like me, I'm hungry, I'm just going to eat. I'm not worried about looking at the label. I want food. I'm not going to wait. So just rethink it. What am I actually putting in my body? Let me read it. Let me go over my calories. Let me go over my total fat, my sodium, my total carbohydrates, my sugar, my protein. And actually, another Kroger story. I went to the store and I picked up a pumpkin pie, and then I looked at, oh look, there's no sugar added to that one. So I checked it, and the regular pumpkin pie, now this is store-bought, so everybody has their own recipes for making pies. But the store-bought, it had 26 grams of sugar in it, whereas the no sugar added had 2 grams. There's still sugar there, but it's not completely no sugar added. So you want to make sure, look at your labels, check your labels, especially if you see things like Mrs. Dash, oh, it's no salt, but it's high in potassium. So yeah, it's even like with low-fat items, oh, no fat added, but they increase it to put more sugar in it so it tastes better. So just make sure to really read your labels.
There's always been that, go ahead.
And also to visualize like how much sugar you're taking. So like you see a can of Coke and you're like, that's not a lot of sugar. So for example, you have your grams of sugar divided by 4 equals like 4 teaspoons of sugar. So if you have 68 divided by 4, like example here, 14 teaspoons of sugar in a soda that has 227 calories, and it takes you 49 minutes to burn it off.
Can she open that one? Bigger?
Go. Yeah.
Like, can you do that? Or no?
Can you make it bigger? No. There you go.
Okay.
Yeah, it's a lot to burn off. Go ahead, Sarah.
Just like how they try to fool you with that Splenda and Sweet and Low, it's
Yeah.
fake sugar, it's processed sugar. it might not be the natural sugar, but it's all fake. So they tell you it's better to have a little bit less of the natural sugar versus having a whole lot of that fake sugar.
Oh, okay, like that one that says juice straight, where they have the juice, you're thinking you're drinking a good juice.
Yeah, but yes.
But it
yes,
has
soda
like
juice.
sugar.
Or the Diet Coke. The
Yeah.
Diet Coke has all that aspartame and all that fake
Yeah.
sugar in it.
Yeah.
Okay.
So you go with like, you'll see different things like Splenda, aspartame, stevia. A lot of people think, oh, well, stevia is a plant, so I'm good with this. But stevia in its natural, go back to your basics, in its natural sense, is healthy. So I know somebody who has a stevia plant, she usually likes to make it in her iced tea. She'll pull up a bunch of plants, crush it in there, and that's how she drinks her tea. So it's just, like I said, it's a big thing, especially here in the South. We like our sweet tea. So we gotta remember, do I wanna be able to see my grandkids grow? Or do I wanna just eat whatever I want right now? We gotta really think about taking care of our bodies. So just a quick fact, so drinking 1 soda a day can equal extra 25 pounds of weight per year. Yeah, I know.
See, that's what happened.
So this is just a saying, so if you're, the next time you pick up a soda, think about it. Would you really eat 22 packs of sugar? If somebody gave you 22 packs of sugar and said, here, go at it, have at it. Are you really gonna drink that?
No.
So what's the other alternative?
The other alternative, like I said, you can go, if you really want something like, sometimes I'm, like caffeine wise,
Like tea.
tea. Teas, you can do into your teas, black teas, you can do green teas, but make sure to look at what sugar has been added. You can do, you said black coffee, and I'll try to do that, and it does work, it keeps me awake, but I want the sweet taste, I want to taste good. But it's just, you're not gonna have all the normal flavor that you're there. There are gonna be substitutes, like I said, you can have sugar in the raw to add it to it to make it taste better.
How about honey?
Honey, you can do honey. Honey is a great method for that. Just like I said, everything in moderation. So you're not gonna add the whole, oh, half of my coffee is honey, and the rest of it's just black coffee.
I've heard agave is actually like something they've come out with recently that's
And
a
then
good source
Yeah,
too.
tequila?
no, agave is the natural substance.
Well, they make it out of it.
Yeah.
Okay, so that concludes our presentation. Does anybody have any questions for us?
Yeah, that, thing, the diabetes you were talking about?
The gestational for pregnancy or type
Oh.
2?
The one she was telling us about,
Type 2?
was it the type 2?
Yes, where we just,
Yeah.
it's just more controlled by our diet and
Is
lifestyle.
that the same as hypoglycemic?
There's different things. Okay, so like with type 1 with any type of diabetes, or even if you don't have diabetes, you can be in a hypoglycemic state or you can be in a hyperglycemic state. All it means is that hypo, low sugar. Hyper, high sugar. It doesn't mean that you necessarily have to have diabetes. So if somebody tells you, if your doctor comes in and they do blood tests on you, they're like, oh, you know, you're kind of hyperglycemic right now, or you're hypoglycemic. I remember I went to the doctor and we were in a rush to go to the doctor, and I was like, man, I'm really hungry. Let me just grab the sugar cookie. It had a whole bunch of frosting in it. And I went in, and my doctor was like, well, we're going to take blood. And she took blood. She's like, oh my God, Elizabeth, what's wrong with you? Why are you have all this sugar? You're in a super hyperglycemic state. I should have probably told her that I just eaten a sugar cookie, but I didn't. I was like, she knows what she's talking about.
Okay,
So that's assuming, doesn't necessarily mean that you have diabetes.
But
It's just,
there's also different tests that you can do also, right?
Yes,
You
there's-
don't have to fast.
yes, that's what we talked about, like the A1C test where you said, Sarah talked about they can take the past 3 months. So even if you said, oh, well, I've been taking my daily AccuChecks, I've been testing myself, I'm doing good. Well, to really check that A1C test checks the past 3 months what your sugar has been like. So that one doesn't require a fasting.
Because you can't fool your doctor.
Yeah, you can't fool your doctor with that one. And then, like I said, there's a fasting one, and then there's one more.
Fasting, non-fasting.
Non-fasting, so you're just not fasting. But the A1C sees the big picture.
Yeah.
That's the one, the 3 months back. That's the one that they're probably gonna commonly use if they're finding your answers kind of sketchy or something like that.
What about when doctors tell you that you're borderline diabetic?
That's
Is
when
it is or it ain't?
you're right on that level.
Close.
You're super close. So whenever they took your test, it was like Sarah said, it's 70 to 120. you were probably like at 120, 121 to where you're borderline, you're almost there.
Yeah, but isn't it yes or no?
It's kind of a warning. It's like, hey, you need to
Prevention.
start eating better, lose weight, exercise, watch your carb intake. It's more of a warning so you don't get to that diabetes phase.
So it just kind of goes with just watching your body. Me and Jennifer always joke around because I guess we're the Hispanics at school, and we're just like, man, after we finish eating a big meal, it's like, I really want some fun, Lisa. I really want something sweet. And we always tell each other, oh my God, we're going to be old and have like diabetes to the max.
Because I really do enjoy fun dulce in the morning. It's the Mexican tradition in my family. It's a day with coffee. It's coffee, yes. It's not good.
We love bread, we love dough.
Oh, yes.
So all the waffle and,
Oh, yeah.
yeah, all the, that's sweet
We
stuff.
have a tradition too. So,
Okay. So, any other questions besides that?
No.
Okay.
Yeah.
Yes.
One other one.
Yes.
Back when I was younger,
Mhm.
whenever I'd start getting tired, I could eat like a couple of candies, and all of a sudden I'd feel great, and I'd be like ripping and roaring. I mean, I'd be doing 14, 16 hours a day, no problem. Now I notice that when I start getting a little tired and I eat some chocolate, and I start feeling all right, but then my weakness is chocolate, so I kind of like indulge myself like 3 or 4 pieces, and then all of a sudden I've noticed here lately that it brings me down, it drops me real bad. Is that because of that borderline diabetic thing?
You become tolerant to chocolate.
Probably just like sugar
It's
crash.
like if you
Yes.
let's say you consume that chocolate since you were young all the way for when you get old, your body becomes just like it can't take that chocolate anymore. It's kind of like a car. It's great when you first start out, works nicely, and as it gets used and used and used, it gets kind of worse and worse, and you have to keep maintaining it and fixing it. So you have to maintain your diet, lower that chocolate amount because your body got used to that chocolate. Unfortunately.
That's what's happening.
Okay. Sure. You're not on my friend list.
Sorry.
So what's your question?
You can look to dark chocolate. Do you like dark chocolate or
Oh
not?
no, I hate it.
Okay. Because dark
Is
chocolate,
chocolate better for you?
it is better for you. It has less sugar in it, and it's actually supposedly heart healthy as well.
Yeah.
So that's a better option. Get dark chocolate covered almonds. It helps with the dark chocolate taste, but it's still your chocolate. I like this.
Okay, so just a quick question. Can anybody tell me how they learn? Like, what type of learner are you? Are you the type of person to where, no, you gotta show me before I learn?
Yeah,
Or I have to,
Yeah, that's me.
I like to listen and learn and take notes? Or are you just to where you see it and you're good? Does anybody know what kind of style they are?
I'm all of them.
You're all of them? I'm
Yeah.
all of them too, so you can be all of them. You can be the active listener taking notes. You can be, just show me once and I got it, I'm good like that.
No,
Or-
I'm the hands-on person.
The hands-on person.
You like to write notes?
Yeah, I like
Yes.
to write notes and what you do.
Look at write notes and help you choose it. Okay.
What about you?
I like to see.
See? Everyone, what do you like to do?
Visual.
Visual? I need that. Either way.
Mr. Nguyen,
I like to see things.
you like to see? When you're going to your doctor's office, what kind of treatment do you think you should receive? And what are the most important things that you should receive from your treatment? This is just a general question.
So like when you
What
go
type
to,
of treatment are you talking about?
like
You're going
any,
in to see them for what?
just for anything, like
Any
like
visit,
personal treatment, like behavior wise, like what do you expect? When you go to the doctor, how do you expect that person
Someone to
to act?
listen to you and be attentive to what's actually going on, and not trying to rush you out
Not
of
in a
there.
hurry.
Yeah,
Yeah.
or your 15 minutes are over, or you got another question, or that's gonna be another charge on your insurance bill.
Definitely.
Yeah, I found that out. I went in for one thing and he started asking me questions, so how you feeling? And then I started telling him, well, I'm kind of hurting over here, you know, or I don't feel real good, I'm kind of tired. Well then, next thing I know, I get another bill in the mail and they just tell me I owe another $40 copay. You gotta be kidding me, you know? What happened to doctor, patient care, you know?
Very true.
That's what it's, we're done. So,
Does anybody want to share anything they learned that they didn't know about diabetes before we started the lecture?
I learned a lot what y'all just said about the hypertension, now I understand more about it. But 'cause before, they would tell me and I'm like, okay, for this, what, I'm okay, so everything's fine. But they never really explained it to me like the way y'all just explained it to me. And I thought that helped out a lot.
I'm glad we can help. I'm glad we can do that. Yes, they did a really good job explaining actually.
Yeah.
And even fish. It's been good to know what's going on, and, you know, what's good for you, what's bad for you, and how everything transpired together. And
Yes, I
And
know
what
it's
symptoms you
amazing.
can look for,
Yeah,
also in your
symptoms,
body,
exactly.
the changing.
I can't believe about the carrots. I didn't know about that.
Yeah, we were both
I always
shocked.
buy those baby carrots and put them in the
Just
snacks.
sit and like
Yeah.
eat
Oh,
them
and
and
you can
That is
finish a
very
whole bag.
Yeah,
And my brother told me, no, don't eat that anymore. That's
Wow.
sugar.
That is very shocking. I love
Yeah.
carrots.
scary.
Yes. Okay.
Thank you for your time.
Thank you so much.
Thank you. And then also,